Consider this. Your brother experiences acute pain and receives an opioid prescription to address the pain. The opioid was prescribed for short-term use, but you begin to notice unusual behaviors in your brother, such as increasing his dosage and for a longer period than intended, neglecting schoolwork and assignments, weight loss, and preventing anyone from entering his room. Upon concerns of unhealthy opioid use, you reach out to your family and the doctor to learn that he is experiencing symptoms of a drug addiction, specifically to opioids. The purpose of this video is to provide education on addictions, specifically opioid addictions, focusing on its prevalence, prevention, and further implications in addressing this public health issue. To begin, here are a few statements to think about as we go through our presentation. 1. Using drugs like opioid painkillers are safe since they're so commonly prescribed by doctors. You can get addicted to prescription opioids even though a doctor has to prescribe them. Everyone is taking prescription pills for fun. Using someone else's prescription drugs is legal. If you use a drug one time without harm, it is safe to do again. At the end of this video, we'll revisit these statements and present the answers based on factual evidence. A drug addiction is a chronic disease affecting the brain and behaviors of an individual, leading to a consistent seeking of drugs that is compulsive and difficult to control. An addicted individual is likely to continue drug use even after harmful consequences. The symptoms and behaviors of an individual with a drug addiction include increased drug use that becomes regular, either daily or multiple times throughout the day, requiring an increased amount to experience the effects, maintaining the drug supply at any means necessary even if the individual has insufficient funds or must steal, participating in risky activities while under the influence, and struggling to stop drug use. While drug use may not specifically lead to addiction for all individuals, there are several risk factors that increase the risk of an addiction. Biology, including an individual's genes, the presence of any mental disorders, and their gender. The environment, such as a history of addiction in their family, economic status, quality of life, stress and abuse, neglect, or other traumas. Development, such as early drug use, and how the drug is administered.
So what exactly are opioids? Opioids are a class of psychoactive substances often used as medication to relax the body and relieve pain. Prescribed opioids used for medication include oxycodone, morphine, and codeine. Opioids such as heroin and fentanyl are often misused for inducing euphoria. Using a powerful drug runs several short-term and long-term health risks if used improperly. Short-term effects such as drowsiness, euphoria, nausea, difficulty breathing, constipation, sleep apnea, headaches, dizziness, confusion, and impotence in males may occur. Longer-term side effects of using opioids include substance use disorder, increased tolerance, worsening pain, liver damage, infertility in women, life-threatening withdrawal symptoms in babies born to mothers taking opioids, and overdose.
An opioid addiction is characterized by symptoms and behaviors that are indicative of physical and psychological dependence on the opioid. Some of the signs and symptoms include cravings, incomplete responsibilities, withdrawal, prescription medications finished early, and opioid intoxication. Additional causes include accessing opioids through legal or illegal means, increased tolerance in quantities, compulsivity, and opioids creating artificial endorphins that allow you to feel good and block pain but affect the brain. With increased opioid use, there's heavy reliance on the endorphins that may prevent endorphin production. Additional risk factors include unemployment, poverty, contact with high-risk individuals and environments, tobacco use, and previous rehab for drugs or alcohol. In Canada, there is a growing opioid crisis as a result of prescribed and illegal opioids. In 2016 alone, there were 2,861 opioid-related deaths and 16 opioid-related hospitalizations per day, affecting approximately 74% of males and a majority aged 20 to 49 years old. The opioid crisis has been a result of both opioid and non-opioid substance use. After the USA, Canada is the second largest consumer of prescription opioids. A survey concluded that 1 in 6 individuals use prescription opioids, or a third of those had no prescription. The most common source of access was through family members with a prescription, among other routes such as prescription fraud, internet purchases, and through multiple doctors. The presence of fentanyl has seen an alarming increase, especially in the illegal drug market, and continues to be a major factor contributing to the crisis. It is being found in 50% of heroin samples and 53% of deaths across Canada when compared to illicit drug overdose deaths not related to fentanyl. The highest burden for opioid-related deaths occurs in Western Canada, in BC and Alberta, and the Northern Territories, Yukon and Northwest, as well as increasingly in Ontario. Across Canada, the rate of apparent opioid-related deaths was 7.9 per 100,000 population in 2016, most high in Alberta and British Columbia. Specific populations across Canada experience higher rates of substance use. A report in Western Canada identified First Nations communities to be at risk by 5 times more for opioid-related overdoses and 3 times more for death due to an opioid overdose. Another report identified the risk of opioid-related harms for homeless populations, identifying that 30% of individuals with an overdose and 50% of individuals aged 13 to 18 have admitted to the emergency department with unstable housing. Finally, in prisons and in penitentiaries, in 2012 to 2014 alone, there were 92 unintentional overdoses, and in the following year, there were 6 fatal overdoses.
When using opioids, the best way to prevent an addiction or other harm is to be educated about how to use them. Healthcare providers can educate their patients about how and when to use their opioids without risking harm to themselves. People using street opioids can also be educated through videos and pamphlets that can be distributed to them so they're aware of ways to stay safe. It's also important for people who use opioids to know they always have access to resources when they need it. Some approaches one can take to reduce harm associated with opioid use include carrying a Naloxone Kit. This is a fast-acting drug used to reverse the effects of opioid overdose. Visiting safer consumption sites or visiting overdose prevention sites. Getting your opioid tested by a drug check-in service. If you do consume street opioids, here are some things you can do to keep yourself safe. Do not use opioids alone. It is best to use with a friend or someone else in case of an emergency. Do not consume opioids that have been tampered with, and do not mix it with alcohol or any other drugs. People struggling with an opioid addiction often face discrimination and face barriers when it comes to getting help. Stigma associated with opioid use is driven by stereotypes, societal factors, and the criminalization of drugs. Perceiving drug users as dangerous people translates into negative attitudes towards people with substance use disorder. This stereotype often leads to internalized stigma as well, where people who use drugs apply these negative attitudes to themselves and feel shameful. Instead, to ensure people with an addiction feel safe enough to get the help they need without feeling misjudged, we can change our understanding of drug use and help end the stigma. It's important to understand addiction is not a choice and it is a treatable medical condition. It's best not to define anyone based on their drug use and instead show compassion and support towards them. We can challenge these stereotypes by educating those around us about substance use disorders. Whether you need it for yourself or for someone else, help is always available. These are a few of the 24-hour services provided in Canada for substance use disorders. You can also contact your primary healthcare provider if needed.
Let's head back to the beginning, where we shared some true or false statements with you and uncovered the answers. Statement 1 is false. Prescribed opioid painkillers for severe pain management post-accident or surgery can be used short-term. If used for long-term, there is an increased potential for addictions and other consequences like overdose or death. Statement 2 is true. There are several risk factors and causes that increase the risk for opioid addiction. Individuals and their families should be well informed and educated on appropriate opioid use as a way to prevent addictions. Statement 3 is false. A majority of people are not. Opioids may commonly be used to treat pain, either chronic or acute. a survey conducted in Ontario found that 1 in 10 students use prescription pills at least once within the year to reach a high. Statement 4 is false. It's illegal to use someone else's prescription drugs. Some people who experience an addiction may go to the extent of forgery, stealing, or going to many doctors to obtain drugs. There may be charges of possession of these drugs or giving or selling them to a friend. And finally, statement 5 is false. Your tolerance toward a drug changes if you choose to use the drug again. Further, the source of the opioid may be found in the form of fake prescription pills where it is unknown what the pill is made of and the amount of a specific substance.
To access resources available in your specific province, visit this page. There are several addiction helplines, mental wellness, and substance use disorder services provided on this page.
We hope that this video has been informative on the topic of opioid addictions and is helpful to you and or anyone you know that may be struggling with this topic or would love to learn more. Thank you.